My interest in atrial fibrillation stems from being a sufferer myself. My breathing was giving me trouble and I went to check. But I'm one of the lucky ones who then had cardioversion, which was successful. But I learned a little bit about it, and there's two reasons really why I become really enthusiastic about wanting to play a part in helping people deal with atrial fibrillation. One is to raise awareness. One of the shocks I had as a sufferer, I'd never heard of atrial fibrillation until I suffered from it. And I think that's very common with people. And it just struck me, if I haven't heard of it, I felt also that the clinicians I was dealing with had hardly heard of it either. And this is just ridiculous. Something that is just so common. So many people suffer from it. And the level of awareness is absolutely abysmal. And it just seemed to me there were so many reasons why we should be trying to raise knowledge and awareness about this illness. So many benefits for the country as a whole. And this is where we come to today's document. I mean, one way is promoting the use of the NHS Improvement GRASP AF clinical audit tool. Now, that was written down for me, but I would never ever remember it. Well, Dr. Fay and Julie Bob are going to tell us an awful lot more about this. But what we're really talking about is a way of identifying people who are at highest risk. Over to you, Julie. Thank you.
Thank you, Glyn. And on behalf of Glyn and the AF Association, I would like to thank you all for coming along today for the GRASP AF initiative. Most of us in the room, but some of us maybe are not aware that AF, atrial fibrillation, is one of the leading causes of stroke. In fact, maybe up to 12,000 strokes each year could be avoided if AF was diagnosed and appropriately treated. And most importantly, the uptake of anticoagulants to help prevent AF-related strokes. But approximately 50% of people who should be anticoagulated are not. And so we're walking around every day at high risk of suffering a devastating stroke. In order that we take action and we improve the health outcomes for people with AF, and to achieve significant financial savings to the NHS, because we're very much aware that there is no new money, we have to look at what we've got and how better we can spend that money. And so it's imperative that more AF patients in need of anticoagulation are identified and offered the preventative treatment that they're actually entitled to receive. And now there are more anticoagulants to choose from, and even better chance that patients are treated appropriately and their risk of stroke reduced. So, as Glyn said, the guidance on risk assessment and stroke prevention for atrial fibrillation, or as we all have come to fondly know it as GRASP AF, much easier to remember, is a free software. It's a software tool promoted by the NHS improvement team that can significantly facilitate this task. And if it's used to its full potential, this tool could prevent up to 8,000 AF-related strokes in England every year. And this could save the NHS £96 million in the process. I'm not the clinician, I'm not the expert. I'm from the AF Association. But at the AF Association, we also have Clinical Experts Medical Advisory Committee. And I'm really pleased today that Dr. Matthew Fay has travelled to join us to talk us through the details of how the GRASP AF tool works. So I'm delighted to welcome Matt. Matt is an AF Association Medical Advisory member, but he's also the National Clinical Lead at the NHS Improvement. So Matt, thank you for being with us today, and I know you're going to give, if nothing, but an entertaining speech.
Thank you very much. Thank you very much. I'm here to just talk about AF, and I'm the clinical lead. So I'm going to try and explain this to you. I think we can look at GRASP and we can try and grasp the numbers that AF is dealing with every day. I mean, it's the commonest arrhythmia in the country. You see figures bandied about maybe there should be 750,000 people in the UK who might be suffering from AF. We think that's probably untrue. It's clearly over 1 million people in the UK are probably suffering from AF. And we're not looking for it properly, and so we're not finding it. Our next problem comes that the AF is a problem of older age. So as our population ages, this is going to be a bigger problem for us in the future. It's already an epidemic. Where will it be in 20 years' time when we have so many more older people? We know that people with AF have a 5-fold increase in their risk of stroke. We know that if you've got another couple of conditions, maybe you're suffering from high blood pressure or diabetes, your risk of stroke is dramatically doubled. And we know that if you don't take any treatment for your AF, within a year you have a 5% risk of suffering a stroke. Of all ischemic stroke, about 15% is due to AF, probably higher, probably closer to 20% if we looked harder. What the GRASP tool tells us is how many people are out there on my practice list receiving aspirin, not being defended against a stroke that could debilitate them or kill them. What I need to do is identify them easily, and that's where the GRASP tool comes in. Developed by Keith Tyndall, who I'm really pleased to see is here today, who developed that in Leeds as an arrhythmia nurse, and now we've rolled it out across the country, and we have over 7 million people have had that data uploaded to the Primus data set. So we know more about AF now in our population than we ever have before. We know the people who we are treating with aspirin. We know the people who we need to change their treatment and start using anticoagulants. We've seen the development of the NHS improvement teams spreading out, teaching us what to do in clinical practices, stretching into the hospitals and trying to change them. We've seen the cardiovascular networks mobilising the GPs to actually do this work in their practices, to understand the size of this problem. But let's forget about all the technicality. Let's try and grasp the people, because that's actually what this is about. We know that AF reduces your quality of life. We know AF inflicts stroke onto people, and many people consider stroke a fate worse than death. We know that the stroke that people have are nasty strokes. It's going to take me about 4 hours to get home tonight. 10 people will have a stroke because they have AF. 8 of them would have been known to be at high risk. 6 of them will be on aspirin or no therapy. Only 3 of those patients will go to their own homes. 5 will go to a nursing home, and 2 won't even leave hospital. And that is why we have a big issue with AF and stroke in this country.